Occupational therapy utilizes what you want and or need to do in your daily life to create treatments and goals and outcomes of therapy to enable you to live your best life. The word occupational can be deceiving though. Occupations are not just the job that you work at, but also the things you do throughout the days. And the list goes on and on. It's just everything that you want to do and or need to do to continue your life and make it meaningful to you. And I say that because what may be meaningful to you may not be to someone else. And that's one thing unique about occupational therapy is that we center those treatments around what's meaningful to you and help you to succeed in your life.
Pediatric occupational therapists work in a variety of different settings, and they primarily work with children who have developmental delays and disabilities. For example, oftentimes we work with children who have autism and cerebral palsy and other developmental conditions such as this. As OTs, we work all the way from the NICU when you've got a child who is born prematurely. We work there with positioning. We work in the school system with academic sort of modifications to the classroom and helping a child be successful in that environment. And then also in outpatient and early intervention services where we help the child be functional in their daily environment and do the things that they want to do, such as play.
Another setting an occupational therapist can work in is an inpatient hospital setting. Some diagnoses often seen here are ortho-related, such as joint replacement surgeries, or neuro-related, such as spinal cord injuries, traumatic brain injuries, or strokes. And the main role of an occupational therapist in this setting is to promote functional independence in the client by restoring the habits and roles and routines that the client once held before they got this injury and had to come to inpatient rehab. And this can be accomplished by the therapist assisting the client in restoring a self-care routine or helping them find ways to participate in the hobbies that they once found enjoyable.
So, some outpatient therapy services may focus on certain aspects of your life, such as work related rehab or sports related rehab. And there are some therapists within any of the outpatient therapy services that focus on certain things or have a specialty in certain areas, such as certified hand therapists or certifications in low vision, pediatrics. There's lots of certifications, and it might gear you towards getting therapy from someone who specializes in the area of concern to yourself.
Occupational therapy in geriatrics places a huge emphasis on safety and independence. Occupational therapists can provide services in long term care facilities, residential facilities, hospitals, or skilled nursing facilities, as well as in the person's home. The goal of treatment for these individuals is usually to strengthen any deficits, be it physical or cognitive, and to teach these people how to use assistive devices that can help them to live safely in their home for as long as possible. Caregiver training and education is also a huge part of this because so many older individuals are cared for by their children or other family members. Occupational therapy can help with a wide array of diagnoses in this population, from those who have had a stroke, those who have experienced a devastating fall leading to a hip replacement, or those with dementia who need help remembering how to do their daily tasks. This is a huge practice area for OT, and with the growing elderly population and the recent emphasis on aging in place, it'll continue to be of great importance.
Another setting that occupational therapists work in is mental health care settings. Physical disability is not the only barrier to being engaged in meaningful activity that people may face. Mental illness, such as depression, anxiety, or substance abuse, can also create barriers for people to be engaged in what they find meaningful in their lives. And so what occupational therapists can do to help these individuals is to teach coping mechanisms to deal with their symptoms, to overcome what they're dealing with. We can teach them about the importance of just being engaged in occupation, finding those activities that are meaningful, being engaged in their community. So it's not just that we're treating physical disability or impairments, we are holistic providers. And so we want to address every aspect of what makes a person who they are so that they may live the most meaningful life possible.